The study, SARS-CoV2 Water-Based Epidemiology in Gauteng, September to December 2020, is a short-term collaborative project between the University of Pretoria, Water Lab, and the CSIR, aimed at monitoring SARS-CoV2 in river water to provide early warning of increased SARS-CoV2 circulation in South African communities lacking sewage systems. SARS-CoV2 infection causes gastrointestinal symptoms in approximately 5 to 20% of individuals, but virus can be shed in the stool of up to 30 to 60% of infected persons. Although infectious virus has been detected in some stool specimens, the likelihood of infectious SARS-CoV2 in wastewater or other water environments is very low. SARS-CoV2 has been detected in wastewater in multiple countries across the world, and in Europe, Australia, and the USA, increases in virus levels in wastewater preceded increased numbers of clinical cases by up to 1 week. South Africa has poorly functioning wastewater treatment plants in many regions, and many communities lack formal sewage networks. Monitoring of river water for the presence of SARS-CoV2 and changes in its concentration may provide early warning of increased circulation of the virus in a given community. Frequent sampling and real-time analysis are required to generate useful data that could guide public health policies and interventions. A WRC-funded proof-of-concept study was performed between June and August 2020. During this study, SARS-CoV2 was consistently detected in sewage influent at various treatment works in Gauteng, the Western Cape, and KwaZulu-Natal. SARS-CoV2 was also detected in rivers that are impacted by runoff pollution from nearby settlements. The study report can be found at the link shown on this slide. The methods optimized in the WRC study by our consortium will be used in the current river study. The river study will focus on 3 rivers in Gauteng. Weekly samples will be collected and virus will be recovered with the skimmed milk flocculation method. Real-time RT-PCR assays will be used to detect the virus, and concentration trends will be monitored using CT values. SARS-CoV2 strains will be confirmed with nucleotide sequencing, and the partial spike protein gene of selected high-titer samples will be analyzed to assess the diversity of the circulating strains. If the river-based surveillance approach proves successful, it can be expanded to other areas and provinces to assist in the control of the COVID-19 pandemic.